Rochester Lifestyle Medicine Institute is very honored to welcome Dr. Robert Breakey to the Lifestyle is Medicine lecture series. Dr. Breakey is medical director of the IHA William J. Fileti Institute for Lifestyle Medicine, and he is on the board of directors for Plant-Based Prevention of Disease, otherwise known as PPOD, and is chairman of the board of the Plant-Based Nutrition Support Group, otherwise known as PBNSG in Michigan. And Dr. Breakey is a fifth-generation graduate from the University of Michigan Medical School, who is board certified in family medicine and in lifestyle medicine. He has practiced lifestyle and family medicine in Ann Arbor for 36 years and has special interests in health promotion, positive wellness, and supporting the natural healing process that we all have within us. He's also one of the most engaging speakers you will ever hear. In this lecture, Dr. Breakey will lead us in an exploration of why and how a whole food plant-based lifestyle can help support us in enjoying a long, healthy, fulfilling, and productive life well into our elder years. So we are delighted to welcome this brilliant and entertaining speaker. Sit back and enjoy. Health is a gift you give yourself. Dr. Breakey.
All right, thank you, Ted. You know, I think in terms of the energetic and enthusiastic about all this, I'm just trying to keep up with you.
Well, I just eat the diet you told me to eat. That's all right.
Thank you for having me tonight.
Oh,
welcome to, wow, over 100 participants from all over the country. You've got a great following, Ted, and I'm honored to be selected as one of your seminar speakers. So I thank you. We do have a lot to cover, though, and I talk fast, so take some notes, and we're looking forward to answering any questions on the backside. Let me go ahead and share my screen and pull up some slides here. All right, can you see my cover slide, Health is a Gift You Give Yourself?
Yes, we can.
All right, so suppose you owned a racehorse and your goal is to win the Kentucky Derby. And now this happens to be Secretariat, one of the greatest of all time. And of course, you have to think about, I need a good trainer, I need to work out for my horse, get an exercise, veterinarian, good food, a perfect jockey. You want to be top of the best, so you want to get all the best of these things. Well, all these are important, but without the right food, none of the rest is going to matter. Let me give you an example. So your trainer says, we're going to get the finest oats and hay for our horse so it can run fast. And you say, no, this horse is an athlete. It needs protein. It needs chicken and fish and cheese and eggs and steak, because that's what athletes need for protein to be fast and run fast. Well, of course, after a while, not only is your horse not running fast, it looks like this. That is not horse food. Of course, we all recognize that, but suppose instead you're issued a human being, and you all were at birth, and your goal is to grow this human into a young, thriving adult, to live healthy and vital into your elder years. Well, once again, you hope to have good genetics, although that only plays a relatively smaller role than most people think. Manage your stress, get quality sleep, have workouts, get medical care, and the right food. You see the analogy here. A lot of people start out up here with good quality of life as a kid. They're working along and may have an acute illness or so here, but about middle age, largely because of wrong food, they start getting overweight, hypertensive, heart disease, and bam, dead at the age of 75. Well, what instead, and this is from the book You Staying Young, you could keep your quality of life, go well on into your 103 age, get struck by lightning on the golf course. You're still going to be dead in the end, but much better longevity, quality of life, and most importantly, not having that last 10 years of suffering. We've got a longer health span than our parents, but a longer lifespan, but a shorter health span. Not only that, though, it looks like this next generation is going to be the first in a long time to actually have a shrinking lifespan. We have so much chronic disease. And when you look at other metrics like midlife mortality and incidence of chronic disease, we are leading the world. So it's pretty sad, the current state of affairs. And again, one of the big components of this is how we feed ourselves. I divide foods into 4 categories: animal on the left, plant on the right, and processed and unprocessed. And you get the idea on here. The processed animal foods are things like hot dogs, cheese, and chicken McNuggets. Up here, at least, it looks similar to the way nature presented it to us. Down here, potato chips, Captain Crunch, oils, foods that are highly processed, often with added fat, salt, and sugar. And up here, you've got vegetables, fruits, whole grains, and beans. So let's keep this in mind as we go through and think first about this bottom process part. It turns out that food companies and agribusiness have hijacked our body's natural taste for sweetness, for calorie density, and for salt to add fat, salt, and sugar to just about everything, to bring what's called a craveability index to foods. And again, if you've been to San Francisco, you may have been here. The waitress brings you this, and you say, "Oh, darn, I should have got what the guy next to me got." It's all loaded with these chemicals and food-like substances that make our bodies think that they're getting something that's good, something that's triggering dopamine. It actually becomes addictive. So these are not really food substances at all. And again, with this group, I don't think I need to spend a lot of time on the processed foods. These are not what you would want to feed your horse if you're trying to win the Derby, or yourself if you're trying to optimize your health. So that brings us down to a central question. What about this top section of more unprocessed foods? Are we natural omnivores where we eat both, or are we more towards the plant-based side, or as some would say, more towards the carnivore side? Well, let's explore this and back up a step to first think, what is food? Well, in its broadest sense, anything organic is food. This rotting tree stump is food for these maggots and ants. This grass is food for this horse. This chicken is food for this fox. And this milk is food for this baby cow. So all these are foods for something, but not for humans. If you give humans foods that were not intended for their health and support their health, they don't do very well, just like our horse didn't do very well. People think that just because it's sold in a Kroger store that it's food, and again, it may give you immediate pleasure, it may keep you alive with calories, but it's not nourishing. In fact, tens of thousands of studies have now documented that the right kind of food can improve performance, heal injuries, help improve health, increase vitality and well-being, and give us longevity. So how do we decide what are these right foods? What makes a food health supporting to humans? Well, the desirable characteristics are pretty well agreed on. Foods should be rich in antioxidants. They should be high in fiber, alkaline in their, as they digest, metabolize, free of cholesterol, anti-inflammatory, rich in phytonutrients, and with a balanced, healthy set of macronutrients. Let's go through and compare our plant and animal foods as we're deciding in omnivore versus other. In terms of antioxidants, the study's been done on over 3,100 different foods, herbs, spices, and supplements. They tested everything from broccoli and lentils to potato chips and Big Macs. And they found a pretty striking difference between the plant foods and the animal foods. See, plants make antioxidants to survive the firestorm of photosynthesis. So the average for these plant foods in the study were over 1,100 units, whereas animals may eat the plants or other animals and use those up in their process, and very little is left in meat, dairy, and eggs. You can see here that diets composed mainly of animal foods were low in antioxidants, and those with the high animal foods were, high animal foods are very low and plant foods high. Why is this important? Well, because oxygen is a two-edged sword. It can help us to extract energy from carbon, oxygen, hydrogen containing molecules and carbohydrates, or it can cause rust or even rapid oxidation and fire. And in the process of metabolizing or extracting energy from food, these free radicals are formed because oxygen is so reactive. These are little molecules with an unpaired electron, and they're nasty little molecules like a bull in a china shop going around creating damage to other cells, DNA. And in fact, this DNA damage leads to mutations that can result in cancer. Proteins are denatured, causing an immune response and chronic and systemic inflammation. Endothelial damage, that's the lining of our blood vessels, creates plaque and atheroma, leading to heart attacks and strokes. And finally, cellular damage throughout the body, leading to premature aging and organ dysfunction. So what's the answer here? antioxidants are naturally occurring in whole, real plant foods, which help to put out that firestorm of metabolism and free radicals. Antioxidant examples include many vitamins and phytonutrients, beta carotene, lycopene in tomatoes, vitamin A in the potatoes, sweet potatoes and carrots and many others. So these then go and help us to extract energy without creating inflammation. One thing people often ask me, but can I just get my antioxidants in supplements? Answer, no. In fact, they've done the studies on supplementing beta carotene or vitamin E, and people actually do worse with that because that's not the way nature intended it. Nature provides these antioxidants with thousands of other reactive chemicals that work synergistically, and when you isolate them out, they are counterproductive. They also come with the macronutrients in natural form that help to bring health and vitality for us. So answer no. So let's put a big 5-star here under plant foods rich in antioxidants and animal foods, very little or none. What about fiber? We say when a woman is pregnant, she's eating for 2. And in reality, all of us all the time are eating for 38 trillion and 1. What do I mean by that? Well, you're the one. And there are over 38 trillion microorganisms within your body, mostly within the colon, that work synergistically with you to support your community. If you feed them well, they support immune function, help balance hormones, manage toxins that naturally come in your food and from your environment. They nourish your colon with what are called short-chain fatty acids. They lower inflammation, not only in the colon, but throughout your body, produce nutrients, and actually signal satiety. They send a message to your brain to say, hey, we're done eating. You ate, we ate too. And they also aid in nutrient absorption. So in contrast, if you don't feed them well, and see if I can get my slides to advance here. If you don't feed them well or starve them, they'll inflame your colon, actually produce toxins, increase the reabsorption of estrogen into the system, and increase the risk for breast cancer for women and hormone-related diseases. They increase serum cholesterol, induce inflammation both in the colon and throughout the body, create leaky gut, which allows substances to leak across the colon and increase, therefore, the risk of autoimmune disease. And what do they eat? Well, fiber. Back in medical school, they taught us this was that part that's superfluous, that's extra, that you don't need. Your body just pushes it on through. Well, in reality, it's vitally important. It feeds these microorganisms, which then in turn feed and support your health. The average American, unfortunately, only gets about 15 grams of fiber a day in their diet. Our poultry dietary guidelines suggest we should be getting twice that. But in reality, if you look at societies where people thrive the longest or study fossilized poop from our distant ancestors, we were getting more like 100 to 140 grams a day. This is the leading food deficiency in our American diet. 97% of people get less than 30 grams. And again, very few get what's really optimal for health. So this is critical. If you look at where it comes from, beans, vegetables per 2,000 calories are some of the best. Fruits and whole grains are also give you plenty amounts. But you start to get to the processed foods, white bread, not much, and down to oil and sugars, and all animal foods have 0. So here's a key difference for us is the fiber of content of a whole food plant-based diet nourishes your microbiome, and an animal-based diet leads to starvation there. You can see this in population studies is that as the amount of fiber in the diet goes up from 15 to 60 grams a day, and we think it will continue even beyond there, down goes the incidence of heart disease, breast cancer, diabetes, and many other chronic diseases. Once again, can't I just get it from supplements? Answer, you guessed it, no. The microbiome are very diverse, and the more diversity of fiber you get, the more they will become diverse. And that really is the most important measure of a healthy microbiome. They don't like these psyllium husks, which, by the way, just may help treat a symptom of low fiber diet, that is constipation. but don't get to the root cause and therefore don't help to nourish your microbiome and therefore yourself. So this does a disservice by covering up that symptom that's giving us a warning sign called constipation. It makes you think you're okay, and it does not nourish the microbiome. So we'll put a big 5-star for fiber here and 0 for animal foods. What about alkaline versus ash? As foods metabolize, they form acid or alkaline ash. And the sulfur-containing amino acids, cysteine and methionine, in animal proteins turn into sulfuric acid. This is a very potent acid. So those with higher protein, like fish, pork, and poultry, give the highest acid load to the kidneys. Now, why is this important? The kidneys are responsible for very carefully helping to balance the acid-base balance along with the lungs in your body. And when they see this huge acid load, they have to secrete large amounts of acid. They form ammonia in the short run to protect themselves, but that over the long run, that can lead to kidney damage and chronic kidney disease. So in contrast, the fruits and vegetables are much more alkaline and more supportive of kidney and overall health. So let's put a 5-star here and an X for animal, which are actually the opposite or acidic. What about cholesterol? Each 3.5 ounce portion of fish, chicken, and beef, and even more for eggs, gives us high cholesterol levels with 0 for plants. Lest you think, hey, that doesn't matter anymore. The good news, I read it in Time magazine. This was based on some very poorly designed studies comparing people on a high cholesterol diet with people on a very high cholesterol diet and saying, oh, they have outcomes are the same, so cholesterol doesn't matter. The analogy there is that's like saying if you crash into a brick wall at 80 or 90 or 100 miles per hour, the mortality rate is the same. So speed doesn't matter. These studies were poorly designed, but it sold a lot of magazines, a lot of journal articles. It got a lot of people happy because, as Dr. McDougall says, people love to read that what they love to eat is good for them. Cholesterol really is not at all healthy, in fact, counterproductive for us. And if you look at those areas of the world where people do well in rural China and don't have heart disease, their cholesterols are much lower. In fact, in rural China, they go from 80 to 160 with an average of 127. Our cholesterol levels start there with an average of 215 and end up many people in the high 200s. These people have almost no heart disease. These people have almost 100% if you look at the arteries. So cholesterol definitely matters, and you want to be down in this range. The only way to get there naturally is by avoiding the cholesterol, saturated fat, animal proteins in the diet that trigger that. There are some saturated fats in coconut, palm, and other tropical oils, but for the large part, they come from the animal foods. So let's put a 5-star here for completely cholesterol-free and large amounts of cholesterol in the fatty parts of animal foods. What about inflammation? And this is critical. Plant foods turn out to be anti-inflammatory. We've already talked about rich in antioxidants, supporting the healthy microbiome, and we're going to come to phytonutrients. But this makes them help to put out that natural inflammation process that comes from extracting energy from food. In contrast to animal foods, the average quarter pounder has 100 million bacteria on it. And these mostly die in cooking, but not before they form what are called endotoxins. These survive cooking, stomach acid, and digestive enzymes, and then the saturated fat in the meat, dairy, or eggs aids the absorption. And they accelerate atherosclerosis, that is hardening of the arteries and stiffening of the arteries, and insulin resistance, that's the precursor to diabetes. Secondly is arachidonic acid. This is a substance our own bodies use to induce inflammation when it's needed. If you step on a splinter or get a scrape, your body uses this chemical messenger to call out the troops to bring in blood flow and start the healing process, bring in immune function. Well, plants don't make arachidonic acid, but other animals do, especially chickens if you're cooped up in a small cage or housed by the tens of thousands at a warehouse. And that arachidonic acid goes into the meat or eggs of those chickens and these other foods too. And when people eat it, they're eating a message of inflammation throughout the body, create inflammation. The next is heme iron. They taught us in med school this was the preferable form of iron because it's more easily absorbed. But we now know that heme iron is actually a pro-oxidant. Not only do animal foods not have antioxidants, it's a triple negative, but they actually create free radicals because the pro-oxidant form of heme iron is pro-inflammatory. And this is linked then with higher incidence of diabetes, heart disease, stroke, cancer. You see per milligram, 16% increase in diabetes. And it's not hard to get a milligram, especially from these shellfish and red meats. Are very high in heme iron, and therefore very pro-inflammatory throughout our system. The next is carnitine in meat, especially red meat, and choline from eggs, which metabolizes into the gut of people who eat animal foods to trimethylamine. This is oxidized in the liver to trimethylamine oxide. Once again, bad actor. This creates inflammation and sets us up for chronic disease. You can measure TMAO levels within 2 hours of a person eating an Egg McMuffin meal. These levels rise, and you also measure a concurrent stiffening of the arteries that occurs in part related to that inflammation from the TMAO. Here it is from the New England Journal. These foods go in the front door, gut flora, metabolize into hepatic FMOs, and atherosclerosis then leads to stroke, heart attack, and death. In part because of these compounds. So you're seeing a pattern here, this inflammation stimulated by arachidonic acid, bacterial endotoxins, heme iron, TMAO, then sets us up for a host of chronic diseases, which aren't really, as Dean Ordish says, not really different diseases at all, just different manifestations of chronic inflammation in different people. Time Magazine calls inflammation then the secret killer. And we really need to pay attention to this and see that having that 5-star anti-inflammatory foods versus the pro-inflammatory side of animal foods is a critical component of a healthy diet. The next is phytonutrients. There are over 30,000 different disease-preventing and health-promoting phytonutrients in plant foods. Phyto stands for plant, so that means only occurring plant foods. Bioflavonoids in citrus fruits, lycopene in tomatoes, phytates and beets, carotenoids and carrots and sweet potatoes. All of these then go and help produce critical components of our immune support and health support throughout the body. These are not optional. And again, one of the measures of a good diet is how many of these phytonutrients it contains. So we'll put rich here and again, devoid of phytonutrients over here. And finally, everybody thinks about macronutrients, that is protein, fats, and carbs as the most important thing. Well, if you look at areas of the world in the blue zones where people live longest and healthiest disease-free, their diets are about 80% complex carbs. And we differentiate that from simple carbs like sugar and white bread, cakes, and candies. But these are carbs from lentils and beans, from whole grains, fruits, and vegetables, about 10% protein and about 10% fat. You see the animal foods are all fat and protein without carbs, with the exception of sugar or lactose in milk, but very unbalanced form of nutrition for humans. But it goes beyond that. The source of the macronutrient makes a big difference. We think of meat as synonymous with protein. And in reality, one of the things you see is that protein is not optimal for us. You can't be very long plant-based before you find that your protein, if someone asks you, where do you get your protein? Well, you all know the answer to that from this audience. Which of these have protein? Of course, answer all of them. These are all complete quality proteins with all 8 of the essential amino acids and more than twice the amount that we need. We only need about 5 to 10% of our calories from protein in order to get what we need. So it goes beyond that, though. We already talked about the animal proteins high in the sulfur-containing amino acids, making them acidic. They're much more allergenic. Dairy and eggs, in particular, are the 2 leading causes of food allergy. They're pro-inflammatory, inducing a host of inflammatory cytokines. They stimulate this hormone called IGF-1 that fans the flames of cancer. It's like a growth hormone. And in contrast, the plant proteins are the opposite, less allergenic, alkaline, and not stimulating the cancer-promoting IGF-1. So we used to think that animal fat was the source of all evil. And of course, industry to the rescue. We've got skim milk and low-fat cottage cheese. I don't know how you make fat-free ballpark franks and egg beaters. Now recognizing, though, that animal protein is also creates an environment where colon, breast, and prostate cancer, osteoporosis, and chronic kidney disease thrive. It also independently raises serum cholesterol. So these things are also put forth. So in one study, looking at populations of people in middle age, those with the higher protein intake had a 75% increase in overall mortality and a 400% increase in cancer death during the following 18 years. This was either abolished or decreased if proteins were plant-derived. And again, a big part of that is the stimulation of a growth hormone called IGF-1 that fans the flames of cancer, that makes it increase. Sorry. Right. So a key take-home point there is that I'm sorry, my slides advance again. Sorry, let me make my slides advance. There we go. So key take-home point then, that animal protein is not healthy for humans. It creates an environment where people have increased risk of chronic kidney disease, osteoporosis, and cancer. What about the fats? Well, animal foods, we already talked about cholesterol versus none for plants. They have more saturated fats. They also contain what are called trans fats. These are the ones that...
Bob, I'm just going to interrupt you for 1 second. But we're just going to, so the background sound noise is pretty loud in your house.
Yeah, okay, hold on a sec, sorry.
Yeah, you might have to go discipline somebody.
Yeah.
Thank you. And, my apologies.
Sorry about that, thank you.
Sorry.
Yeah. Okay, so saturated fats are largely present in animal foods, and these trans fats are the ones that the FDA banned, but they naturally occur in animal foods and are responsible for stimulating heart disease and cancer. They also commonly come with a lot of heavy metals and contaminants, especially seafood, and the opposite true of plant foods. So what about Time Magazine again? It said that saturated fat's actually good for us again. Once again, study is very poorly designed that sold a lot of magazines and a lot of butter, but not the truth. Saturated fat's also implicated in strokes, blood pressure, breast, prostate cancer, enhancing that trimethylamine absorption and Alzheimer's disease. What about the carbs? We talked about animal foods have no complex carbs. They do have sugar in the form of milk, and that lactose metabolizes to galactose, which they actually use to induce premature aging in laboratory rats. It's not a healthy sugar, and most humans can't even digest it. In contrast, plant foods are rich in complex carbohydrates, high in fiber, and do not have the lactose with just small amounts of galactose. So on a separate table here, we can see then that the proteins, fats, and carbs are not only present in the right proportions, but much better quality from the plant foods. And if we come back to our main table here, we can finish it off with plant foods having the right balance and health promoting source of macronutrients, and animal foods quite the opposite. So are we noticing a pattern here? Is this just a coincidence that the plant foods seem to support humans in best health and the animal foods actually pull us down? Well, no, these are the foods that nature intended for us. These are what our ancestors evolved on. So of course, we're perfectly matched to eat what a majority of the world's population has eaten for thousands, tens of thousands, millions of years, a whole food, plant-based diet, maybe small amounts of animal, but certainly no processed foods. And here's the summary then: plant foods health supporting, animal foods actually health degrading. To add icing to the cake, so to speak, if you look up and you see this coming out of a bird, and you know you got to clean off your windshield, you say, oh, and then recognize that in a survey in 2011, 90% of retail chicken showed evidence of contamination with fecal matter. In the processing plants, the automatic processing of eviscerating the chickens inevitably leads to what's inside heading into the meat. It's not just chicken, but turkey, ground beef, and pork are all largely contaminated with the fecal matter from the animals that they came from. So 48 million are sickened annually, thousands hospitalized, and many die from this foodborne animal infections. It goes beyond that, though. We used to think that this bovine leukemia virus in cows, which is almost ubiquitous now for large animal farms, which are most of them, 100% were infected with this virus. We used to think, well, so what? It's a bovine, it's a cow virus. But we now recognize by looking at breast cancer cells from breast cancer biopsies that the DNA from this virus is stitched into these cancer cells, implicating that in up to as many as 37% of breast cancers. So raw red meat and milk containing these bovine leukemia virus may be in part responsible for our large epidemic of breast cancer. We know other cancers are caused by viruses too, the HPV causing cervical cancer, others causing leukemia, and this AIDS also Kaposi sarcoma. So this is an example of a foodborne cancer in the form of infectious disease. So we're back to our main table here. We can say we're left with a whole food plant-based diet as that which optimally supports human health. Fruits, vegetables, whole grains, and beans with scattering of nuts and seeds. And we say, so what does all this mean for people with an interest in optimal health? This is Karen. She came to me in November of 2017 after she saw a talk much like this one, adopted a whole food plant-based diet, lost 34 pounds in 10 months, really without having to try very much. And then her hemoglobin A1C, a measure of diabetes control, came down from significantly out of control to normal simply by her diet change. This is Tim, one of my patients who came in for his physical with pretty common numbers. You know, he's a bit overweight with a BMI of 27. Normal's less than 25, 23 is even better. He's overweight, but not obese. His blood pressure is borderline 130 over 90. His cholesterol, 206, you know, sort of average American, and blood sugar, low space of prediabetes, 104. Well, this was Tim's left anterior descending artery lesion in his heart after he had an episode of chest pain. This is the so-called widowmaker. And although Tim was sort of average American, he found that he needed to do more. He's now plant-based and doing quite well 4 years later. So in this plant-based healthcare concept, then, we address the root cause of these chronic diseases, whether it be diabetes, hypertension, cancers, or heart disease, and see if we can both prevent and reverse them. These so-called diseases of affluence, which are so ubiquitous in our society, should really be more accurately called foodborne chronic disease. Just like salmonella can cause a diarrhea syndrome, saturated fat, animal protein, and lack of fiber can contribute to the inflammation and processes leading to these diseases. So a fundamental paradigm shift is really essential. I call it plant-based healthcare. It's like a division of lifestyle medicine. And Rochester Lifestyle Medicine is one of the best examples of how you can implement this in the real world to support people in supporting health. One thing to help for people is to make a change is to say, what is your why? This is me in Cabo above the Pacific Ocean on what they call a flyboard. I like to be adventurous, you know, ski fast and boogie board and rollerblade, do stuff like this. My wife was safely on the beach during this time. And for each, it's their own. But whether you like to do what you want to do, you need your health in order to accomplish that. Understanding that key importance of the truly nourishing food, and indeed that an ounce of prevention is worth much more than a pound of cure. We learned this in seatbelt use when back in the 80s, seatbelt use went up as seatbelts were, laws were put in place, and down came the fatality rate from automobile accidents. So what we're talking about here is a seatbelt for your fork. And we learned it also with smoking. As the rates of smoking went up and up and up with about a 30-year lag, so did the rates of lung cancer in men. And then as smoking rates went down after the Surgeon General's report, down came the rates of lung cancer in men. So you see the significance here. All of these deaths were largely preventable had people just not smoked. And the area under this curve right here represents saved lives if we hadn't done the Surgeon General report and people continue to smoke at same or higher rates. So we have that same opportunity now with the American diet. It used to be tobacco was our leading killer, with diet and activity second. And now the American diet has surpassed tobacco as smoking rates have fallen, and the American diet has gotten even worse. Here's my Uncle Don with his son Scott, my wife and I on the 4th of July 6 years ago. Don was everybody's favorite uncle, always a smile, a helping hand. Well, unfortunately, he died 2 months after this of colon cancer. And once again, largely preventable. Dr. Stephen O'Keefe from University of Pittsburgh presented at the PPOD section with the conclusion that a change from a Western plant diet to a plant-based fiber-rich diet has the potential to reduce colon cancer 20 to 40 fold. Not 20 to 40%, but 95% as we switch people to a diet that supports colon health. And what about diabetes? For many years, I've been the head of our family medicine division. We ask our new doctors, is diabetes reversible? Well, about half of them say, well, no, once you've got it, because that's what they were taught. About a third say, well, maybe under extreme circumstances, and only a small percentage get it right. This is Antoine. He came in one day with a hemoglobin A1C of 11.7. Normal is less than 6.5. And actually 5.7, 6.5 we consider okay control. But his fasting blood sugar should be less than 200. Cholesterol, as we mentioned, 150 is optimal. Triglycerides 150 and microalbumin should be less than 30. He was wildly out of control. And I said, Antoine, you either got to go on a whole food plant-based diet or take insulin. He said, Doc, I don't like needles. I'll do the diet. Well, he came back 4 months later. His A1C was normal. His fasting glucose had dropped to almost normal. His cholesterol almost 100 points. Glycerides almost 600 points, and his microalbumin down to normal. So his kidneys were no longer straining. This is an example of diabetes reversal just from changing his diet. Here he is 4 years later, down 30 pounds and feeling better than ever. Makes a big difference, just the food. Well, what's going on here? In type 2 diabetes, people have insulin, which is responsible for helping the sugar move from the bloodstream into the cells, but it's not effective. So the sugar builds up in the bloodstream and the cells are starving in the face of plenty. What's gumming up that lock to keep it from working? It's the fat, so-called intramyocellular lipid or saturated fat inside the muscle cells, which prevents that insulin signaling process from occurring. Saturated fat in egg yolks and fatty dairy products, red meat, chicken, and fish, that creates that setting for diabetes. It's not just the amount of fat, it's the amount that people eat. Back when I was born, chicken was just about 12 pounds per person per year. And then came the curdle and a bunch of others, and now over 50 pounds of chicken per American per year. And they've also obesified chickens in that same time frame. They're 4 times the size, with going from 2 or 3 grams of fat per chicken breast up to over 20. Similar with cheese, used to be just small amounts, and now over 30 pounds per person per year on average. And cheese is over 70% fat, high in saturated fat. So our epidemic of diabetes, once again, key take-home point, is largely due to chicken and cheese as key drivers of this diabetes epidemic, because the amounts people are eating and the amount of fat that contains them in our current understanding of type 2 diabetes. Many people are surprised by that, like, oh, vegetarians eat cheese, it must be healthy, or chicken is the lean meat, it's good for you. And this is couldn't be further from the truth. Dr. Barnard's book, Reversing Diabetes, is a great example of how people can take a straightforward approach to taking type 2 diabetes and getting it out of their lives. But diabetes is only number 9 on the leading causes of death. It actually contributes to many of these others, so it's beyond that. But the worst is heart and circulatory disorders, strokes, heart attacks, hypertension. And this is because this plaque-like goo builds up in the arteries. And Ted makes a side living on helping clean this out for people, but it's not normal. If you look at the arteries of people in the blue zones, they remain squeaky clean into their 80s and 90s. What's happening here is that saturated fat, inflammation are teaming up, cholesterol teaming up to create this epidemic of disease, which, as Dr. Esselstyn says, need never exist or progress. It's a food-borne illness. Here it is from a 43-year-old surgeon as part of his study with a raggedy coronary artery completely opened up 3 years later. And Paul Chatlin, the head of plant-based nutrition support group, is a similar example of severe heart disease reversed through whole food plant-based diet. Multiple sclerosis, this is my patient Colleen, can also commonly be greatly improved or, if caught early enough, reversed. Dr. Sarai Stanzik has a documentary, Code Blue, which you should watch also, and she's another great example of a person, a doc in this case, reversing her multiple sclerosis. Dr. Brooke Goldner has reversed lupus, and many of her patients reversing other autoimmune disease through her whole food plant-based program. So by getting to the root cause of these, we're getting to help people heal and maintain vitality. If you have these on your yard, you've got to get down here and get rid of this, or you'll have this. A good example here is George's story, where George was headed down a path of challenge. He was 83 here. He said, came in beaming one day. He said, Doc, I watched that Forks movie and 4 months plant-based, and I feel better than ever. Well, his weight came down from obese to normal. His blood pressure dropped on medications. His bad cholesterol dropped from very high to within the usual normal range. Usual triglycerides dropped. And importantly, his vitality went from low to excellent. He got off all of his medications. What's happening here in hypertension, blood vessels, arteries are not just tubes that carry blood flow with getting pumped from the heart. They're lined with muscle. And these muscles help to support blood flow as it comes out from the heart. They contract too. But again, as a result of chronic inflammation and buildup of plaque, they can't help. So the heart's just rising to the occasion, saying, good help is hard to find. I'm going to have to raise the pressure to push it through these narrow, stiffened tubes. And as a result, that blood pressure puts a strain on the kidneys, the blood vessels, and increases the risk of stroke, heart attack, and other complications. So again, can come back to this if you want, but in plant-based healthcare, we view hypertension as quite rare. It's a symptom of adverse diet that can be corrected. The effectiveness is excellent. We don't need monitoring or medications, and the complications are low compared to the usual approach. So here's where we think of stroke, heart attack, and chronic kidney disease as caused by high blood pressure. How many have heard he had a stroke because he had high blood pressure? We stop there and say, what about what caused that? From the stiffening to the endothelial damage, to inflammation, to oxidative stress from saturated fat, animal proteins, and meat, dairy, and eggs. So the real root cause is down here for these conditions. It doesn't stop here and just get treated with medications. So when people nourish their bodies with this type of food, they look, feel, and perform better. The documentary Game Changers, you should watch if you haven't, now available on Netflix and other sources too. Go to the website. Documents how peak athletes are finding that they can improve their performance. And again, it's a no-brainer, really. All of these pro-inflammatory components from the animal foods, stiffen tissues, decreased blood flow, decreased performance and increased time needed for recovery and pain versus the plant foods that help them to perform better, both endurance and strength athletes. So the bottom line is eat as if your life depended on it and your health, because they do. This is my breakfast every morning with the steel cut oats, goji berries. You add some berries, ground flaxseed, some turmeric, pumpkin pie spice, top it with a little splash of almond or oat milk, whatever you like. And it really makes a tasty, healthy breakfast. For lunch, quinoa, sweet potato, and salad with balsamic dressing. You can get whole grain breads and hummus, vegetables, soups, stews, grilled vegetables. We still love grilling, but we put the veggies, corn, and fruits on there. And the pineapple's especially good. This is my daughter's miso stew, not just a couple of floating pieces of tofu and scallions. We had cabbage and mushrooms, and make it fun. All these foods are where the colors and flavors come from. So make it fun and enjoyable and healthy. And then before we finish, just want to mention one more component, and two more really. One is we live in this part of the universe called the biosphere. If the Earth were the size of the basketball, all known life in the universe occurs within this piece that would be as thin as a piece of plastic. And we're abusing it. Every day, eating whole food plant-based is much more efficient. So it saves 1,100 gallons of water, 45 pounds of grain that could be used to feed people, 30 square feet of forest, especially the Amazon, 10 pounds of carbon dioxide in one animal's life. Speaking of that last one, we see this on the grill, but don't think that these represent real sentient beings that have the ability to experience pain and caring for their families and for others. So it's also a way of eating cruelty-free. Additional resources from PBNSG on nutritionfacts.org. You can take a picture of this or get back to it on the recording if you like, but lots of great resources now. So much more than when I started 44 years ago out there on the web and books and documentaries. Dr. Greger, with his work through nutritionfacts.org, is amazing. And his book, How Not to Die, is, I think, the best that I've seen, summarizing dietary and lifestyle approach at nutritionfacts.org. Finally, PBNSG is a great support group that has chefs' recipes, visiting speakers. And all of this really is just part of a broader food revolution that's building momentum by the week. Remember this chart with the chicken? Well, look at this end part where it's starting to tick down at the end. In fact, if you look at all meat consumption, decline of since 2007 of 12% and continuing as people recognize that it's better for themselves, better for the planet, and better for the animals to eat this way. So finally, though, before you go out and hit your friends and family over the head with it, remember there's no love sincerer than the love of food. Well, maybe a grand puppy dog. It's also nice when a carnivore loves its food instead of eating it. But be careful bringing people along, helping them know there's not just right or wrong. There's a continuum, and the more you do, the more you gain. It's not all or nothing, and even substituting one serving of meat per week for one serving of beans gives some benefit. So don't think it has to be all at once or all at nothing, and help people to meet them where they are so that they can make a gradual transition at their pace and gain the benefit that many of you have already experienced. And that is to say, when you have your health, you have 1,000 dreams. And when you don't, you have just one. So this is my wife and I in Sedona. Let's move to question time and see if we still have any time for that. Oh, we do. 8 minutes.
That was wonderful, Dr. Breakey. Thank you so much. And just when you put up the animals in your slideshow, one of my animals showed up. So.
Oh, is that nice? I get.
This is Carnegie. He's our alpha male. Anyway, it was a wonderful talk. I can't believe how much you covered in less than, 45 minutes. It's amazing.
I got.
Yeah.
Thank you.
And yeah. So we got some great questions, and I'm actually going to start with the last question because I think it's really good. So my questions are psychological. How to make these shifts without feeling deprived? So she says she's currently lacto-ovo vegetarian with a sweet tooth. Hard to imagine giving up cheese, for instance, and eating more vegetables. So not to feel deprived.
Yes. Yeah, great question. That's a very common one because we commonly talk about, hey, these foods are not health supporting, so you give them up. And really, one of the techniques for that is instead of thinking about taking away foods, think about adding. And Dr. Greger has an app for this called the Daily Dozen. It says, hey, each day I'm going to get this many servings of beans, and vegetables, and berries. And by making sure that you get all those, it tends to crowd out some other things. You've got sort of a certain amount that your body will even let you eat every day as far as calorie amounts and before you get too full. So if you start to add foods in, you'll find that the others start to gradually drop away. So that's one technique. The other is to, and Dr. Barnard talks about this, is think about 3 meals that are already that you really like, and how can you make them different enough so that instead of say chicken in your stir fry, you use tofu, or instead of your beans and franks, you make it with beans and tempeh. You do some substitutions that still give you that reminder of what you've always liked. And another technique for this is to think of ethnic foods, Mediterranean and all the flavors that go there, Italian, Thai, the flavors and spices. And of course, find ones that you like. And as you explore, you'll find things you never knew were out there. You'll find new tastes and adventures. So by focusing on adding and making it fun and doing, you'll find gradually some of the other things will drop away. It also is true that you kind of get used to what you like, and you eat what you like, and you like what you get used to. And as you make these changes, you find that not only do you start liking more things, but the things that aren't as good for you don't taste as good anymore. And the sweet tooth that you had is really just filling a craving. As I mentioned with the strawberries back in our ancestors' days, fruit was a way of triggering dopamine. Those who found it would get a reward in the brain. Well, by extracting it out and making heavy sugar the new normal, you need that just to feel normal. And once you get off that roller coaster, once you get away from the sweets, you find the natural sweetness in food gives you even more pleasure. I was eating a peach the other day. I'm like, wow, how did they do that? They didn't make peaches like this when I was a kid. Well, when I was a kid, I was eating Captain Crunch and Pop-Tarts and ice cream and Oreos. And now that I'm not, that sweetness is even more enjoyable. They've looked at studies too from people who are transitioned to plant-based eating. And on average, they get even more pleasure from their food than people who are just trying to kind of fill in the withdrawal symptoms with fat, salt, and sugar. So make it gradual, explore, make it fun. You'll find your taste change over time. And most of all, think of your end goal. We do a lot of things with that may seem at first like it's not what I want to be doing. I'd rather be, watching TV than on the treadmill. I'd rather be X, Y, Z. But the benefits that come from that way more than outweigh whatever sense of, quote, deprivation you may be sensing from it. So just a few thoughts for you.
Oh, that's great. Thank you for that. Gosh, there's so many questions here. Here's an interesting one. Can you talk a little bit about the relationship of plant-based eating to the susceptibility to COVID?
Yeah, very interesting. COVID, of course, it takes advantage of the fact that our immune systems are not able to get it before it gets a foothold enough to start to spread to other people. In some, it induces such an active immune response that it goes overwhelmed and they get the COVID lungs and can die from that. That's all part of an over-inflamed environment in the process of fighting an infection. And if you start already with a very high level of inflammation, it doesn't take that much more to push it over the edge. A second piece is that fatty tissue called adipose tissue contains a receptor called angiotensin receptor. And it turns out this is the one where COVID preferentially attaches. And this is why for people with overweight or obesity, COVID can commonly be that much worse for them. It just has more environment to be able to go to and spread. So people who are plant-based have a lower inflammation, better blood flow, more immune support from a healthy microbiome, and less systemic inflammation in their system. So you might expect, well, they're going to do better. Now we have at least 3 studies demonstrating just that, that there's a significant decrease, forget the exact numbers, but a significant decrease in the incidence of COVID in people who are truly whole food plant-based, and in the severity when they do get it, lower risk of hospitalization or death. So yes, great question. It's not just COVID, it's other infectious diseases and diseases, chronic diseases that do better or worse depending on what you eat, largely for those reasons.
Right. So we're almost out of time. Let's just do one more question here. It's about insurance companies. Are they being pushed to pay for lifestyle medicine visits?
Yes, great.
And are more doctors being encouraged to include this information in their work?
Yeah, it's a tough one because you kind of get what you pay for. And so far, our medical system has been saving people in a dramatic way through treating the symptoms or the end stages to try to keep it going, even though it was preventable early on. There are many reasons for this, but it's in a system that has evolved in a completely backwards fashion, where instead of, if we're really trying to promote the health of the populations we serve, we would focus first and foremost on prevention and reversal. The insurance companies are partly responding to that system of education. This is what doctors and systems have done for so many years, that there's an inertia there. And also they often make 1% of the premium. So it seems paradoxic that they wouldn't want to lower costs, but if you shrink the pie, their percentage total take goes down too. Now, some that are what are called fully capitated, like Kaiser, do actually have an incentive, and Kaiser has made a direct appeal to their providers to say, hey, a whole food plant-based diet really is the way we should be thinking in terms of especially treating diabetes, heart disease, and many of the common diseases we see. So it's changing, but slowly. Good question. It's a hard one to manage, but we're getting there.
Yeah, no, it's a good question, a good answer. I'll just add one more thing to that is people should know about the American College of Lifestyle Medicine, which is advocating for this and has been for quite a number of years now. And if you're a healthcare professional, you can join. And if you're not, you can just certainly check out their website. So that's ACLM, the American College of Lifestyle Medicine. And with that, we are out of time. And Dr. Breakey, it's been so much fun having you here tonight. And we have so many more questions. So obviously this aroused a lot of interest, but hopefully we'll have you back someday. So
all right, that sounds great.
Thank you so much for coming, Dr. Breakey.
Thank you, Ted. Appreciate it. Thank you to all for attending tonight.
It's quite welcome. And this will be recorded and available on YouTube in a few days, and you'll all get notices. So, all right. And with that, we're going to shut it down for the night. Thanks, everybody. Have a good night.
Good night.